Okay, I believe we have started, and I am broadcasting live both on Zoom and in nutraMetrix Facebook group right now. So if you are joining me either on Zoom or on the Facebook page for nutraMetrix consultants and health professionals, welcome. My name is Brandi Murphy. I'm the Director of Training and Field Development for nutraMetrix, and I so thank you for joining me this morning on this beautiful morning when we're going to be talking about the economy of healthcare and some of the challenges that are faced by healthcare professionals, not only in these unique times, but on an ongoing basis, and how the solutions offered by nutraMetrix can help them. So I see we've had people join me on Facebook. Guys, I'm going to come back and make sure that I answer any of your comments by the end. So if you have any questions, just go ahead and pop them in the box down at the bottom where the comment box is. Say hello, let us know where you are joining from. If you're joining me from Zoom, go ahead and say hello in the chat window. Again, welcome for joining me. You know what would also be helpful to me if you let me know a little bit about who you are in the chat box. I don't need too much information, just where you joining me from. Are you a nutraMetrix consultant? Are you a health professional? Or are you new to nutraMetrix and here to learn about what nutraMetrix has to offer? With that said, I'm going to go ahead and bring up my slides, and we're going to get right into the presentation on the economy of healthcare. Okay, so you should be able to see my slides now. If somebody on Zoom can just go ahead and type into the chat box that you can see my slides, that would be super appreciated if somebody could let me know that you can see my slides. Awesome. Okay, thank you, Donna. Thank you, Christina. Thank you, Nancy and Mary. Awesome, I so appreciate it. And Jolynn, it's great to see all of you in here. So let's go ahead and get started. What we're going to be talking about today is why should health professionals consider, especially in these days and times, offering wellness programs to their patients? And you know, our healthcare system in the United States is not really a true healthcare system. It's actually more of a sick care system. Most of our health professionals, their practices are set up around diagnosing, prescribing, or treating diseases after they've already started or after they've already presented. And this is a huge, huge industry. So I'm going to share with you some statistics. And I hope that this just gives you an idea, especially if you're not a health professional yourself, gives you an idea of a little bit about the economy of healthcare in the United States, just as a background for the rest of our discussion. And so what you see in front of you is an infographic that came, excuse me, that came out in 2015. So it's a little dated, but the concept is still relevant. And I'm going to update these slides in just a few minutes. The statistics in just a few minutes on the next slide. So in 2015, $2.9 trillion were spent annually on healthcare. Now it's over $3 trillion. Of that, about 75%, 2.175 trillion, was spent on chronic diseases such as heart disease, diabetes, obesity, cancer, mental disorders, and osteoarthritis. And what I want to share with you about that is many of those conditions do have a lifestyle component to them. So the problem with waiting until these disease presents is that it's a lot more expensive to treat them after the fact than it is to focus on preventing them from happening in the first place. So these numbers come from 2019. They're right out of Blue Cross and Blue Shield's infographics for practitioners and for patients. And they talk about the fact, even the insurance companies are talking about the fact that unhealthy lifestyle behaviors are contributing to this high cost of healthcare. In fact, despite all the education that's out there today, 1 in 5 adults still use tobacco. 1 in 3 adults are obese, and 1 in 6 adults consume alcohol excessively. And this contributes to huge amount of spending working on treating the conditions associated with these unhealthy behaviors. Then if we look at what are the costs of treating these chronic diseases that often have a lifestyle component to them as well, just take a look at these numbers. About 128 billion spent on arthritis related treatments, 147 billion on obesity related treatments. And guys, these are 2019 numbers, so these are updated. 157 billion on cancer related treatments, and 315 billion on cardiovascular disease type health challenges. Now, we know that we can make drastic improvements in people's cardiovascular profiles by helping them embrace healthy lifestyles, getting enough exercise, making sure that they're eating a healthful diet, making sure that they're getting the nutrients needed for optimal nutrition. So we're going to go through this. We're going to talk about this a little bit more. I found this particular infographic, again, from Blue Cross and Blue Shield, a little interesting because what it shares shares with you is that 1 in every $5 or $6 of our GDP in our country is spent on healthcare. And again, it reiterates that 75% of that spending is spent on chronic disease management. Yet there's little emphasis on true preventative wellness. Even if you think of your own healthcare plan, right? What are the wellness-based services that are covered by your provider? Usually it's things like mammograms, pap smears, colonoscopies, but these aren't really preventative wellness measures. They're more early detection measures, right? So even the healthcare insurance providers that are talking about how a preventative model could save money and gives infographics like this to employers so that the employers can help reduce overall healthcare costs, they aren't covering these wellness-based preventative services that a lot of patients need. So this infographic made me laugh because it says for every dollar that somebody spends on losing weight and staying fit, we could decrease their healthcare costs by almost 3 times. The use of wellness programs, every dollar spent on an employee wellness program, their medical costs fell by $3. For every dollar spent on a wellness program, their healthcare costs fell by over $3. Yet most of those wellness programs aren't covered by these same insurance companies. They also talk about quitting smoking and using urgent care facilities instead of ERs and using generic medications whenever possible. But my question to the healthcare insurance companies is why not cover the preventative services to begin with? Okay, so we're going to go into a little bit more about that later on in the presentation. But for now, let's talk about some of the other economic challenges that are faced on a regular basis by our health professionals. And that is rising business costs. The cost of doing business goes up every year. Cost of rent, cost of employees, cost of healthcare for the employees, all of the services that practitioners need, things like transcription services, medical billing services, all of those costs go up every year. Yet at the same time, we see in mainstream media news articles that reimbursements are often cut every year. The amount of money reimbursed to the practitioners, either through Medicare, Medicaid, or private insurance companies, seems to keep going down. So in order for this to happen, practitioners end up having to, or in order to cover for this, practitioners end up having to see more patients every year to continue bringing in the same amount of revenue. But bringing in the same amount of revenue often doesn't cut it because the cost of doing business is going up. And the practitioners are limited by the number of hours in the day and how many staff members they have to how many patients they can see. Add on top of this that there's always ongoing changing regulations and reforms, and those often require practitioners to invest not only training time, but expenses into staying compliant with those changing regulations. So let's take a look at something that came out in 2018, and it talks about, this came from the Medscape Physician Compensation Report, and it talked about how practitioners felt about administrative work in their practice. So how many hours per week were spent on paperwork and administration? And the reason why this is important is I hope you understand, and maybe you don't if you've never worked in the healthcare arena, practitioners only get paid when they have a patient in front of them, when there is a billable service by treating a patient or working with a patient that's directly in front of them. The administrative work that goes into following up after that patient leaves is not a billable service. So let's take a look at the amount of hours that practitioners spend on an ongoing basis. So less than 5 hours per week is only about 11% of the practitioners that were studied. 5 to 9 hours per week was about 18%. 10 to 19 hours per week is about 38% of the practitioners surveyed are spending 10 to 19 hours per week just on administrative work. And then some of them spend more than 20 hours per week on paperwork and administrative challenges. Now, some of these practitioners can have some staff members that are helping them with these administrative tasks, but not all of them can. So these are following up with chart notes. These are importing documents into the patient's electronic health records. These are making sure that they're working with the insurance companies to get paid on the billable services that they provided, that they were contracted to be paid for. But often they have to fight the insurance companies to get reimbursed in a timely manner. All of this time, greater than 60% of our practitioners are spending greater than 10 to 20 hours a week on administrative work. That means it's time that they can't have a patient in front of them. That means it's not a billable time slot in their practice. This creates less time for each patient. And as patients ourselves, all of us have been a patient at some point in our lives and probably see a practitioner at least once a year. All of us have noticed that the amount of time that we get to spend with our practitioner tends to go down each year. We now often in a typical healthcare practice might spend more time with a physician assistant instead of the doctor or a nurse practitioner. Many of us have started seeing nurse practitioners as our primary care practitioners because they get to spend more time with us, which is awesome, right? But the amount of time that the average practitioner spends with each patient, let's take a look at this. Less than 9 minutes, that's not the norm, but 9 to 12 minutes, 22% of the practitioners get to spend 9 to 12 minutes with each patient. 29% of practitioners between 13 and 16 minutes per patient. 33% of practitioners between 17 and 24 minutes per patient, and fewer than 12%, only 11% get about 25 minutes or more with each practitioner. Now, depending on the type of specialist, maybe it's your family doctor, maybe it's your internist, they might be able to give you a little bit more time, but your specialists, I mean, can you really get everything that you needed to get covered with your practitioner? Can you get all of your questions answered? And can that practitioner accomplish all the goals they had for their patient and providing good patient care in under 25 minutes? Sometimes some of them are really good at it, but sometimes they struggle with that. And we're going to talk about how that impacts their job satisfaction, right? Because what is the most rewarding part of the job was asked on this physician's compensation report as well. And the relationship with patients was the most rewarding part offered by many of the practitioners. Yet when they only have 15 minutes with each patient in each visit, it's hard for them to maintain that relationship and really have a good relationship with their patient. Being good with what I do and finding answers, diagnosing things, 24% of practitioners responded with that. Knowing that I'm making the world a better place, there's a lot of personal fulfillment in the healthcare industry. But when you don't get to provide the care that you really would like because the system is broken, it leads to less job satisfaction and it leads to more burnout. So let's take a look at what are the most challenging parts that the practitioners recommended or talked about. Having so many rules and regulations, having to work long hours, dealing with difficult patients, having to work in the EHR system, and difficulties getting fair reimbursement. Those are the things that make it really challenging for them. And we find that many of them would advise colleagues going into their field to maybe choose a different field. So as a result, we're seeing fewer and fewer people wanting to go into the healthcare arena because many of them have been told, you're going to work really long hours, you're not going to get paid what you thought you were going to get paid. Okay, so now here's an interesting article that came out last year, and it's talking about when I brought up to you changing regulations. The electronic health record system was a very big project that was launched a couple of years ago where all healthcare providers had to be able to move to an electronic health record system. And this article, and I have a little source there, if you'd like, I can send this out to you. Just send me a message or comment below and I'll link it in the chat box or in the comments. It really talked about how the electronic health record system kind of created more problems than it solved. And it created a lot of fatigue for practitioners. It created a lot more hours for practitioners. And many of the practitioners now end up spending a ton of time in their evenings and on their weekends trying to get caught up on keeping their electronic health records up to date. So the average time out of an 11-hour workday, now just think about that, doctor's average workday is 11.4 hours. The average time that they spend on EHRs is about 5.9 hours. And that's even more than what they're spending with their patients. So they're spending 5.1 hours with patients and 5.9 hours in an 11.5-hour workday working on their electronic health record system. That means that they're not in front of the patient necessarily. Now, some of them do try to work on them while the patient is in the room. And you may have experienced that where you're trying to talk to your practitioner and they're busy typing away as they're updating their charts. That's because they have to get these chart notes updated and there just isn't a lot of time for them to do it in our current system. So as a result of all of these challenges, right, there's the regulatory changes, there's the rising cost of business, there's the decreased reimbursements. We have more and more practitioners that are starting to look for creating new services in their practice that are cash-based, that can provide additional revenue to the practice. Because when they have to reduce the amount of time that they see with the patient, they need to be able to maximize the return that they get back on their revenue. So you see more and more practices offering ancillary services. And that same compensation report, the physician's compensation report, this time it was from 2015, mentioned that practices can earn as much as 15% of their overall revenue from these ancillary services. So what kind of ancillary services am I talking about? In-house pharmacies, maybe generic medication dispensing, weight loss services, in-office diagnostics, nutrition counseling, cosmetic services. I mean, I've seen practitioners offering laser hair and laser tattoo removal in an OBGYN office. They're offering more aesthetics type services because they're cash-based. They are paid directly by the patient, and there's no waiting for third-party payers like insurance companies to reimburse for these services. They're also offering things that are more wellness focused, like acupuncture and massage. So let's take a look at why a practice might want to consider adding ancillary revenue to the practice. And I'm going to give you a snapshot of a practitioner that I worked with in Florida, an internal medicine doctor, and he was good enough to share with me what his monthly costs were in his practice. So just to give you an idea, a snapshot of what an internal medicine practitioner's practice might look like from an economic standpoint, this particular provider saw about 20 to 25 patients per day. He had an average reimbursement of $60 per patient per visit. So when we look at the number of days that he saw patients, he did see patients 5 days per week, but depending on how many days are in that month, you know, February is a shorter month than some of the other months, the average gross intake at 20 to 25 patients per day with a $60 reimbursement per patient was somewhere around $1,200 to $1,500 a day. On the days he saw 20 patients, it was $1,200. On the days he saw 25 patients, it was $1,500. So his average gross monthly intake on shorter month days, or shorter day months, was $26,000, and his average intake on longer months was $33,000. Now you might be thinking to yourself, well, that sounds pretty good. $33,000 in revenue for a practice sounds pretty good. Well, what we don't tell you here is what his expenses are. His average expenses were $27,000 a month. Now, what would be included in those expenses? The lease on his building, paying for his staff members' salaries, paying for insurance for his staff members, equipment leases and rentals, having the transcription service and the medical billing people working with him as contractors that I talked to you about. All of those costs add up. So there were some months when he had shorter months and didn't see patients, like maybe in Christmas, if he on December, he shuts down for the holidays or whatever holiday he experiences, right? He may actually have more money going out than he has money coming in, despite seeing 20 to 25 patients per day and bringing in what many people would consider significant revenue. So the net owner to the net profit to the practice at the end of a good month would be about $5,000. But there were months where he was actually pulling from his retirement to keep his practice afloat. So I just wanted to share that with you because practitioners out there are looking for ways to bring extra revenue to their practice. And now let's talk about the unique situation that's happening in March 2020 right now, because this is something that I think nobody ever anticipated happening. We have a lot of our practitioners right now who have reached out to me over the last week or two, and they're saying things like, thank goodness I created an ancillary revenue stream, because maybe they're a massage therapist or a physical therapist and they require physical contact with their patients. And they can't really go to a telemedicine model. Many of them have seen a decrease in the amount of patients that they've been able to see over the past 2 weeks, which means their revenue's going down. But they still have to pay their employees if they have them. They still have to pay for their employees' insurance if they have it, if they have employees. They still have to pay the lease on their building. They still have to pay the lease or the equipment rental for their practice. So although their expenses aren't going down, this unique situation that has created it where people can't go do all the things that they normally do has triggered a revenue decrease that these practitioners maybe didn't anticipate. But the practitioners who have built a successful wellness-based practice that has an online component to it, which I'm going to talk to you about in a few minutes, they still have revenue coming through whether they have patients in front of them or not. Their website that's offering product sales and cash-based services is working for them whether the patients are in their practice or not. So I bring this up because we are in a unique time, and a lot of practitioners right now are trying to take advantage of these extra cash-based services that can be provided ongoing, whether the practice is open or not, through reorders, whether the practice is going or not. And some practitioners haven't gotten there yet. And they might be kicking themselves a little bit like, I wish I would have prepared for this. I couldn't have seen this coming, but I wish I would have. And there's an old Chinese proverb that I want to remind everybody of. And it goes, when you want shade, the best time to have planted the tree was 20 years ago. But the second best time, if you didn't do that, was today. And I bring that up because practitioners today are more aware, especially over the last 2 weeks, of the need for having ancillary services that don't require physical contact with the patient. And many of our practitioners are able to move to a telehealth model over these next couple of weeks and keep revenue coming in. But even if they can't move to a telehealth model for their primary service, they can move to a telehealth model for wellness-based services, okay? So I mentioned at the beginning of this webinar that our traditional model of healthcare in our country isn't really a healthcare model. It's more of a sick care model. It's more about taking people who are sick and trying to make them well. But patients really do want a lifestyle-based approach. Patients want to try to avoid getting sick in the first place. And I just like to point out this article that it's all the way back from 2011, right? And it was written by John Wong. It was an economic analysis of nutritional interventions for chronic disease prevention, and talked about methods, research, and policy. And they say persuading people to live a healthier lifestyle via supplementation and dietary interventions will result in lower overall healthcare costs, which is what we were talking about early on. I want to talk to you about how patients are already out there seeking wellness approaches, and they don't need to be sold on the idea of supplementation. They don't need to be sold on the fact that what they eat contributes to how they feel. In fact, when we survey patients, and we've surveyed thousands of patients across the US, many of our practitioners have found that their patients have told them they would prefer to get wellness information from their provider than from somebody that works in a retail store. Right? The person that works in the retail store doesn't know anything about the practitioner's goals for the patient or the patient's goals for their own health. The retail person that works in the store doesn't know anything about the patient's medical history. They don't know anything about what medications they're on and possible contraindications that might be there. So just think about it. If you've ever bought a wellness product in a retail store, did the person even ask you if you're on any medications? Did the person even ask you if you've talked about these types of supplements with your practitioner? Most likely they haven't. Maybe you found somebody who was really well versed and did, but most of the time the retail professionals aren't doing that. Okay, so let's talk about the fact that patients don't need to be sold on supplementation. These are 2019 statistics from the, yeah, I can't see, there's a little, I can't see my slide because the chat box is open, so I just need to move that, sorry. The CRN, Council for Responsible Nutrition, had these studies in 2019, and they said 77% of US adults take dietary supplements, 79% of adult females, 74% of adult males. And when we look at breaking that down by age groups, it's pretty much every age group is taking supplements. When we go even further, 83% of adults with children in the house take supplements, and the main reason is to maintain their health. 30% of people that do take supplements do so for overall health and wellness benefits. They're not necessarily using the supplements to try to treat a condition, right? Supplements are about providing optimal nutritional support for the body. It's not really about treatment, but it's about helping the patient stay well. The top reasons why Americans take supplements is for overall health, things like energy, immune health, to fill in gaps in their diet, to promote healthy aging, and to promote healthy cardiovascular function. So we're seeing this paradigm shift happening, and more practitioners are learning about the role of lifestyle medicine. So I want to take a few minutes and talk to you about this, because having worked with nutraMetrix, which is a provider of supplementation and products related to health and nutrition, I want you to be aware that we don't just focus on selling supplements to the patients or to the providers to sell to their patients. What we want to really help to do in order to move the needle away from a sick care system to a true healthcare system is to get patients to really think about, how are they eating? How are they exercising? How are they managing stress? How are they maintaining healthy relationships? Are they getting enough sleep? And are they minimizing their exposure to tobacco? This entire lifestyle concept is integrated into what we teach into nutraMetrix. It's not just about taking a specific supplement. Although the supplements do help, it also is one part of an overall lifestyle plan. So lifestyle medicine, just because some of you, this might be a new concept for you, lifestyle medicine is an evidence-based approach to preventing, treating, and even reversing diseases by replacing unhealthy behaviors with positive ones. This is going back to the statistics I shared with you in the beginning. 75% of our healthcare dollars are spent on chronic diseases with a lifestyle component. If we can get the patients to embrace healthier lifestyles, things like eating healthfully, being more active, managing stress, avoiding risky substance abuse, getting adequate sleep, and having a strong support system in their relationships, we can help lower those overall costs. So as we go through here, let's talk about when lifestyle medicine was created. The term was first used in 1989, and then in 1999, there was a book published called Lifestyle Medicine, and it was considered to be a landmark publication. The American College of Lifestyle Medicine was founded in 2004, and I think that's very interesting because nutraMetrix was also created in 2004. I don't think that's a coincidence. I think it's because the patient demand was there. I think it's because more and more research was coming out that talked about how disease isn't because of a pharmaceutical deficiency. Disease isn't caused because we need more medications. Disease is caused because we don't have what we need from diet alone, and we're not treating our bodies the way that they're meant to be. So the evolution to lifestyle medicine is looking at the overall lifestyle causes of sickness and disease, not just the individual risk factors or not just the individual symptoms. See, we live in very unique times, and I'm not just talking about these past couple of weeks. Over the last few decades, we have this new problem that we've never had before. Throughout the history of man, food scarcity was a problem. But after the World Wars, right, World War II, for the first time in history, we had the opposite problem. Not only did we have food scarcity, now some places do still have food scarcity, but in the United States, we have an abundance in most cases of food. Most people have more food in their pantries than they can actually eat over the next couple of weeks. Many current health problems are related to excess energy supplies and are due to factors such as fast food, limited physical activities arising from automation, commuting by car, sedentary lifestyles or work, and increase in stationary indoor activities like watching TV. So we have access to more food, although it may not be quality food, right? A lot of the things that you see in the grocery store, unless you're looking at the outer perimeter of the grocery store, that's really foods of convenience. The foods that come in boxes, they're loaded with artificial chemical sweeteners, they're loaded with dyes, they're loaded with foods that have been so heavily processed that our bodies don't even really recognize them as food. But this evolution to lifestyle medicine has shown that by ignoring the root cause of disease and neglecting to prioritize lifestyle measures for prevention, the medical community is placing people at harm. Advanced nations influenced by a Western lifestyle are in the midst of a health crisis resulting largely from poor lifestyle choices. I'm all tongue twisted. I've been doing so many Zooms and talking so much, guys. I hope you bear with me. Epidemiologic, I cannot say it. Ecologic and interventional studies have repeatedly indicated that most chronic illnesses, including cardiovascular disease, cancer, and type 2 diabetes, are the result of lifestyles fueled by poor nutrition and physical inactivity. The American College of Cardiology and the American Heart Association announced new guidelines in March 17 of 2019. Guys, I want to share this with you because even the mainstream medical organizations are making changes to recommend lifestyle interventions over some of the tried and tested and promoted for decades treatments that they used to offer. Clinicians have recommended baby aspirin for preventative cardiovascular health for decades. And in 2019, they came out with a position statement that said clinicians should be very selective in prescribing aspirin for people without known cardiovascular disease. This came from a cardiologist at Johns Hopkins. He said it's much more important to optimize lifestyle habits and control blood pressure and cholesterol as opposed to recommending aspirin. It's not just about the quick fix, it's getting people to understand how their lifestyle impacts their overall health. So some people might say, well, I'm a patient, my practitioners haven't talked to me about my lifestyle. Why is my practitioner not embracing lifestyle medicine? It takes time for a paradigm shift to happen. Most medical schools, even still to this day, most medical schools only dedicate a few weeks of nutrition education into their program. We used to have a nice little course on prevention and diet, says Dr. Walter Willett, a pioneer of nutrition and research and a professor at Harvard Medical School. Half the students who used to take that course changed their diet afterwards, and the majority felt comfortable talking to patients about their dietary habits. But that course has been lost in the midst of curriculum reform. Now, Harvard Medical School is now shifting more to a lifestyle medicine component. We're starting to see the paradigm shifting where practitioners that are coming out of school today are getting more of the lifestyle exposure to them. In fact, in the 2018-2019 school year, which was only a year ago, University of South Carolina School of Medicine in Greenville was the first to incorporate lifestyle medicine into all 4 years of the initial curriculum. Harvard Medical School and the Western University of Health Sciences College of Osteopathic Medicine of the Pacific has also been offering lifestyle medicine programs to their students. But this is only over the past 4 or 5 years. So depending on when your practitioner was trained, they may not have been exposed to this lifestyle medicine component. So how does nutraMetrix help providers with this? Well, we want to be able to help the practitioners who were traditionally trained, who didn't necessarily have the experience in lifestyle medicine in their schooling, to bridge the gap from traditional treatment into more of a lifestyle medicine model. And how do we do that? We have trained nutraMetrix consultants that sit down with our health professionals and they help them define the vision and mission for their new wellness program. We have over 200 products in our product line, and we offer a complete suite of products to all the different practitioners we work with. It doesn't matter if I'm talking to an internal medicine doctor or nurse practitioner, or if I'm talking to an OBGYN, or I'm talking to a chiropractor or a massage therapist or a mental health worker, a psychiatrist, a psychologist, a social worker. We have products that can support the needs of all of their patients. And so depending on the scope of that practice and what their practice goals are, we're going to identify just a handful of products for that practitioner, maybe 3 to 4 products to start with that would help support the needs, the nutritional needs of their patients based on the goals of that patient's health. So once we've chosen the products and services, the nutraMetrix consultant can sit down with that practitioner or their staff and put together a marketing and implementation strategy. Then what we're going to do is we're going to identify which of the patients that either come through that practice's physical office or through their telehealth program would be a good fit for those products. We know 76% of the patients coming through that practice, either virtually or physically, are already taking supplements. But we're going to ask that practitioner to have a dialogue with the patient about what supplements they're taking to make sure, number one, that they are taking the right thing for their wellness protocol, that there aren't going to be any contraindications with their current treatment protocol, and that they're taking a good quality product. I've worked with a cardiologist that's joked with me in the past, and he said, I just can't figure out why practitioners will make a recommendation to their patients to take a health and nutrition or wellness-based product, and then they just send them to the store to get it. He said, for example, I would never say as a cardiologist to my patient, you need a blood pressure medication, go find one. But I've heard so many practitioners saying to their patients, we do recommend you take an omega-3 fish oil and a vitamin D, let me know which one you pick. Because when their patients are going to go to the retail store, they're probably going to pick based on pricing, and they're going to pick on pretty packaging or pretty marketing. But they may not understand that, for example, with omega-3 fish oils, the EPA and DHA ratios matter. And just because a product is of a lower cost doesn't mean that it's effective. If it doesn't have the amount of EPA and DHA that's been shown in the studies to be effective, then the patient might as well not take it to begin with, right? And he would say to them, I'm not just going to say, go get a blood pressure medication and not tell them how many milligrams to take. I'm going to tell them exactly what I want them to take, and I'm going to give them the brand recommendation I want them to take as well. So we help with that population monitoring. We help with the patient engagement so the patient understands what some good products to take for their wellness goals are. And then we're going to measure outcomes. The outcomes we're going to measure are patient improvement outcomes, right? Are the patients getting the results the practitioner wanted for them? And if not, how do we need to adjust the dosing or maybe try a different product to get that? But we're also going to look at the revenue outcomes for that practice. And then we're going to look at future growth initiatives. So this is what we call the nutraMetrix implementation wheel. We help the health professional create their wellness programs, goals, and objectives, and then we put a plan in place working with that practitioner and their staff, whether it's virtually or physically in the office, to accomplish those goals. See, our mission in nutraMetrix is to transform healthcare by partnering with forward-thinking practitioners who go above and beyond in patient care. We provide wellness programs that support not only the health goals of the patients and the revenue goals of the practice, but we use cutting-edge nutritional interventions, revolutionary technology, things like our GeneSNP DNA analysis, where we can actually customize the wellness programs for the patient using laser-targeted personalized nutrition with a DNA analysis. And we have an extensive network of providers that we can collaborate with and help practitioners get training from. Our goal is to change the face of healthcare, one patient and one health professional at a time. We can't do that alone. We have a large network of healthcare professionals, but we also have a large network of trained nutraMetrix consultants. And if you're watching this and you want to learn more about this, what you're going to want to do is reach out to either one of the nutraMetrix health professionals or nutraMetrix consultants that exposed you to this webinar, and get more information about the products and services that we offer. Again, we have a complete suite of customized products that can help our health professionals, a wide variety of product categories, a wide variety of targeted regimens. We have everything from general health products to bone and joint health regimens, weight management regimens, women's health regimens, children's health regimens, dental health regimens, eye health regimens. We have regimens for all different health professional types. In addition to helping our practitioners bring in additional cash-based revenue, we also have a partnership through our parent company, which is called Market America, and their shopping platform with thousands of partner stores that can help our practitioners save money on the goods and services they already buy for their practice and their own household, even being able to save money on things like their credit card processing. So it's worth looking at all the different ways that nutraMetrix can help our health professionals not only generate revenue, but save revenue on what they're already buying. While we're talking about revenue, I want to give you just a simple example. I'm going to give you two of them, two simple examples of how our practitioners can create ongoing revenue for themselves, whether they have patients in front of them or not, whether they're doing telehealth or whether they have in-office visits. In particular, I'm going to share with you one of our #1 selling products. What you see on your screen there is our daily essentials packets. It's actually 4 products in one. It has in it a comprehensive antioxidant formula called Isotonics OPC3. It's based on pycnogenol, pine bark extract, grapeseed extract, citrus bioflavonoids. It has in it an isotonic multivitamin, an isotonic B complex, and a calcium complete, all in an isotonic form. It's a powder. When mixed with a certain amount of water, in this case, because there's 4 servings in here, it's 2 ounces of water per serving, so it would be an 8-ounce beverage. The patient is going to just rip open the packet, mix it in, stir it up, drink it down on an empty stomach. It offers enhanced bioavailability, getting the products into the bloodstream in a usable fashion relatively quickly, and patients notice a difference. That's important because if the patients don't like the taste, patient compliance is really high with this, then they can't get it. They're not going to take it. It's not going to help them. So we want to make sure that patients not only take the products, but they feel better with the products. And that enhanced bioavailability helps the patients get results. So patient reorders are very high. In particular, this comes in a box, what you see here, with 30 daily packets in it. So patients are going to reorder it on a monthly basis. The health professional cost is $55. The suggested retail to the patient is $77. So the suggested retail creates $22 of retail profit per box. If we have a practitioner that, let's see, like the example I gave earlier of the practice that sees 20 to 25 patients a day, let's start with a very conservative example and say our goal is to get 10% of those patients participating with this product on a wellness maintenance plan. So Monday, they see 2 patients that buy the product out of the 20. That's 2 on Monday, 2 on Tuesday, 2 on Wednesday, 2 on Thursday, 2 on Friday. 10 patients have purchased over the course of the first week. By week 2, 10 more. Now we're up to 20. By week 3, 10 more. Now we're up to 30. By week 4, 10 more. Now we're up to 40. Now in week 5, we're starting the new month. So the people that bought in week 1 are going to need to reorder. So by the time we kind of go out 2, 3, 4 months, we're in month 2, we're at 40 people that have purchased every month. Month 3, we're at 60 people that have purchased every month. Week 4, it just keeps going up. So you can see how we could easily get over maybe a 6-month period to 100 patients that are purchasing that product every month. That would be generating $2,200 in retail for this practice. The net retail just on one product to 100 patients purchasing every month would be about $26,400 in additional revenue to that practice in a very simple scenario. Now, that practitioner that I explained to you before that sees those 20 to 25 patients per day, they don't only have 100 patients. They have 5,000 patients. So if our goal is to get 10% to participate, we'd actually be at 5 100 patients that are purchasing. So you could multiply this by the number of patients that you think that particular office would actually have buying. This is just a very simple number based on 100, but it could easily get to a higher amount than that. That practitioner that I was talking about before that was only netting about $5,000, we could actually double his income or more than double his income very easily with an implementation of this one product into his practice. Now that's just the retail that I shared with you. Every box of product or every order of product that comes through the nutraMetrix office also has a point value associated with it. In this example, the Daily Essentials packets have 40 points associated. So the practice, in addition to the $26,000 in retail profit, would generate additional commissions based on those points. How much in additional commissions? Well, in this example, with 100 patients purchasing this one product, it would be an extra $7,200 a year in those commissions, bringing their revenue to $33,600. Again, if they go up to 500 patients over the 100 patients, you would do 5 times that earnings there. Okay, so we can scale this up based on the size of the practice. Now, maybe the practitioner wants to offer more than just one product, the Daily Essentials. Maybe they want to offer our personalized nutrition program through the GeneSNP DNA screening analysis. And instead of using the Daily Essentials, they're adding onto it our genetic foundation bundle, the GeneSNP Foundation. This includes, in addition to the Daily Essentials, a bottle of magnesium, an extra vitamin D, an extra B complex, and omega-3 fish oils. Now, the health professional cost is $156.90 on this bundle. Suggested retail cost to the patient is $215. The retail amount on this bundle would be about $70,000 in retail, just on the retail before we get to the commissions. But those BV points, using the same example, would take us to $90,000 an annualized revenue with the retail profits and the commissions. Now, again, I'm not going to go into the detail as to how all of these numbers play out. We have additional trainings on that you can access in our NC Training YouTube channel, which I'm going to share a link for in a few minutes. But just wanted to give you the big picture of what's available. Now, let's say, because we have so many of our practitioners right now who don't have patients coming in the door, maybe they're doing, because the patients are at home, right? And many of the patients are facing this ability where they want to be able to use their time at home to learn something new, to learn how to live a healthy lifestyle. We have a program called TLS Select, which is a healthy lifestyle program focused on, 12 to 13 weeks of education. So I'm showing you just one example. We have about 9 different examples of how we could create a customized weight management program or healthy lifestyle program through our TLS Select initiative in health professionals practice. This particular program uses the TLS 30-day Jumpstart Kit, which is a product kit for a 1-month product kit to start patients on a healthy weight management program, healthy lifestyle program. So the first month, they're going to do the 30-day Jumpstart Kit, followed by the Stay Fit Kit for 2 additional months. There's going to be 12 weeks of ongoing training that the practitioner provides, and it can be done via Zoom in small group sessions. Let's say you get 10 patients that are joining in on a Zoom together, and the social aspect is there. People can join in and learn about healthy weight loss and healthy weight management together as a group. And the practitioner can charge for those consultation services, even in a telehealth model. So using this example, the profit on this 12-week program would be $519 per patient over the 12-week period. You have 10 patients that are joining that group, it would be $5,000 in revenue for that practice that would be created. So for practitioners whose revenue right now is a little unstable because they normally only see patients directly in front of them and can only get paid when they have physical patient contact, can go to a wellness-based telehealth model, charge for online sessions, and continue to generate revenue so that they can not only meet their medical expenses, their business expenses, but continue to generate revenue for the practice themselves. So again, I hope this gave you a good idea of what's possible with nutraMetrix and what the nutraMetrix solutions are. Your next steps, if you're a health professional, would be to schedule a discovery meeting either in person or right now, probably via Zoom or FaceTime or a conference call with a nutraMetrix consultant or other nutraMetrix health professional to determine the needs of your practice and help figure out which products and services would meet the unique needs of your patient base. Then try some of the products for yourself. Our most successful practitioners are practitioners who use the product in their own house, even with their own family, and use it for themselves and can talk about it from personal experience with their patients. And then when you're ready, after you've had all your questions answered, you can open up your nutraMetrix account.
We just recently released a new Fast Start Kit to make opening your account even easier than ever before. The Fast Start Kit retails for $429.95. That's a $600 value of products. Some of our best-selling products are in there so that you can try the products yourself, but it also has built into it all the business tools that you need, a website to keep your business open even when patients aren't in front of you, marketing support materials, catalogs, overview brochures, all the tools that you need to get started with your nutraMetrix business are there for you in that Fast Start Kit. Now, if you're not a health professional, we also need more nutraMetrix consultants. And so there's a way for you to have a Fast Start Kit as well as somebody that would be an unfranchised owner following our business model and getting trained in nutraMetrix. Now, I did share with you that we do teach the staff and the health professionals how to implement programs into their practice. So if you're an unfranchised owner that wants to be able to work with health professionals, you would need to make sure that you attend a nutraMetrix consultant training, either online or in the future in person as well. Because then we're going to help the health professional train their staff on an implementation strategy, either a virtual implementation strategy or a physical in-office implementation strategy. We're going to train those staff members on how to support the program goals, both for helping the patient improve patient outcomes and helping the practice generate revenue. And we're going to continue monitoring the progress of the practice and make adjustments as necessary. Now, if you want to learn more about this, you can visit nutraMetrix.com. That's our patient-facing product page, where you can see the variety of products that we have and take a look at the product detail pages. You can learn what ingredients are in our products. You can learn how they're meant to be taken. We have a patient-facing Facebook page where we share a ton of health and wellness related information and lifestyle type information. You just go to facebook.com/nutraMetrix. And then we also have several references or resources available for you on YouTube. So I have links for you here if you want to copy them down. YouTube, our main YouTube channel, you can also just search official nutraMetrix on YouTube and you'll find them. For more information about our business model and the details about the type of revenue and income goals that I shared with you on this call, we have a playlist called nutraMetrix Business Overviews. And we have about 15 or 20 different videos there with different health professionals featured, talking about how they were able to create successful revenue streams for their practice using the nutraMetrix system. Now, whether you're a health professional that wants to learn more, or you are a potential nutraMetrix consultant that wants to learn more, we also have several online 101 and 201 events coming up. This is a full day event, 2 3-hour sessions with a 1-hour break in between typically, where you can learn more about the nutraMetrix solutions and how they can help generate revenue for practitioners and for nutraMetrix consultants. Okay, I hope this was helpful for you. I'm going to stop sharing my slides. I'm just going to pop back over and see if there were any questions that I can answer. Some people just saying, thank you for this. I took the 101, 201 last Saturday. It was awesome. I'm glad that you enjoyed it. We had a lot of health professionals joining with us. Awesome. Okay, great. So I'm going to just jump over to the Facebook page for a second and see if there were any comments in the Facebook page, any questions. Hopefully this was helpful for you guys. I don't see any questions there. If you did join us via Facebook or you are watching this on the replay and you do have questions, go ahead and just type them in the chat box. I'll come back later and make sure that your question gets answered. I hope this was helpful for you guys. Don't forget to check the nutraMetrix Facebook page if you are a member of our nutraMetrix community. We have so many events planned over the next 8 weeks. You can learn so much about nutraMetrix. There's never been a better time to build. And we thank you guys for joining us today. Hope you have a great day and a great weekend, and we'll see you again soon.